So it's been 7 weeks since surgery. I have put on quite a bit of weight, which I think is a bit weird because I'm more active than I was pre-surgery, but I think I've been eating better because the gastro symptoms have settled down um, quite a bit. I haven't posted for a while because things have been very up and down. It's been a bit of a roller coaster, really. So the first 2 weeks were quite easy. I was expecting it to be much more difficult than it was. Um, I I suppose there's good stuff and bad stuff, but overall it's good. I set out to be better than I was pre-surgery, and I am better than I was pre-surgery. Um, the slipping ribs up until about 3 days ago were doing great. Um, I've got some increased pain and sensation around the surgical area, which I think is pretty normal because it's the nerves waking up. I'm still wearing ice pretty much all day, every day around the surgical site. One thing that I've noticed is that when I take the ice pack off, because I don't know if you can see, it's elasticated. When I put this on, even when the ice has melted, it helps. It feels like it helps to secure things, especially with 11, and it not stops movement, but it reduces it. So, for example, one of the problems I always had with rib 11 was when I was brushing my teeth, even just movement, I could feel the rib moving inside me. When I take this off to go to bed, when I'm brushing my teeth, I can still feel that, not as much, but it's still there. Whereas if I have this on, it sort of it lessens that movement. So having this is really, really helpful. Rib 11 is still causing some problems, but not as much as it was before. So, for example, one of the biggest issues at the moment is sleep, I suppose, because I still can't sleep on my side on the surgical side, which is to be expected. On the non-surgical side, if I go into the fetal position, which is my most comfortable position, um, bringing my legs up, the rib 12 goes under rib 11, so that's still happening and causing pain. So the biggest challenge for me at the moment is getting to sleep in a comfortable position and staying in that position while I'm asleep, because when I'm asleep, obviously I'm subconsciously, sometimes my body moves into positions where I wake up in increased pain. That's happening most mornings, but I find that once I'm sat down and I've had a hot shower and I've got the ice pack on, it does get to a manageable level. So I'm trying to sleep on my back, which isn't really that comfortable for me. I'm finding that on the nights when I can stay on my back the whole time, I'm waking up quite stiff. And then on the nights when I go into strange positions, I have pain around 11. But I just remind myself, constantly that I'm better than I was 7 weeks ago. I always said, I always told myself that I might not get back to 100%. And I think that way, if I did, then it's a bonus, and if I didn't, I wouldn't be too disappointed. I'm not disappointed because there is still pain and there are still issues, but it is more manageable than it was, which is definitely a good thing. I do think that the slipping ribs themselves, so rib 10 in particular, I do think it's secure. I think that this increased pain that I've had over the past few days is just nerves waking up. Lots of people say that around week 6, so I'm on week 7, around week 6 to 8, sometimes 10, people get sort of information comes back because they're a bit more active. The nerves are waking up. So lots of people report that increase in pain, which is a comfort for me because it's not just me that's getting this, and hopefully it will go away. One of the worst things is that I'm getting pain between my spine and shoulder blade, That was the first symptom I ever had with the slipping ribs, and it's one of the worst. So I've noticed that's come back. I've been using lidocaine patches, but I'm keeping my fingers crossed that it is just the nerves waking up, and settling, and maybe a bit of inflammation. Um, it does take a long time, and I know that, and I need to remind myself that I'm still doing really really well. Um, I will be starting physiotherapy once I get to 3 months. I didn't get any specific post-op instructions, but I know that Dr. Hansen recommends that people who've had slipping rib surgery avoid physical activity for 3 months. I will be doing, you'll know that I did lots of planking before surgery, and I think that helped. I will be doing let me have a look at my blog, I always forget this word, isometric. So I'll be doing isometric exercises. So they are exercises where the joints and muscles don't move, but the muscles contract. So I won't be actually moving the rib cage. So that will hopefully prevent me being in pain. It will hopefully strengthen the muscles around the surgery site to further secure the ribs, and also help the other side, the left side. The left side is just one rib, I think. I'm pretty sure it is, because it's not as bad as the right was, and it started afterwards. But there is a possibility that could get worse with time. So I do want the surgery on the left side, as well, and I'm hoping that will happen at some point, but I'm not ready for that yet. I need to, let the right side settle a little bit more. So that will involve another trip to London, which is expensive and not, it's not ideal to have to go and do that again, but it's something I need to do, and it's something that I need to accept. Physio-wise, I've spoken to my GP. I have a new GP, which is wonderful. I was quite anxious about it because, as I've got not just with this, I've got a bit of a history of misdiagnoses, and it's really affected my trust of doctors. So I was very very nervous. I had an appointment with her to review my meds, because I'm on some other meds that are not for slipping rib, for things. And I explained to her, that I had slipping rib, and she's seen all the letters from my surgeon and things. And she was great. She was really, really good. The previous doctor I had a really bad experience. He's now left the practice, and I have Dr. Burns is my new GP, and she was lovely. She listened. She agrees, on the physio. So yeah, I'll be starting that once I get to 3 months, with a physiotherapist near where I live, an NHS physio. So I'll probably have to. I imagine I'll probably have to teach them about slipping rib syndrome, and how it works, and what the surgery does, and what's happened and things. But hopefully that will work really really well. I've already got some exercises that Joel suggested, so I'll be doing those. But also, I'm convinced that rib 11. If you remember, there was the video of it moving at the front and coming out at the side. It does make sense from me rewatching that video that it has come out at the back. Since surgery, I've had more pain at the back, where rib 11 joins the spine, about an inch away from the spine, and I felt some movement there. That is called rib head syndrome. It's another issue that is difficult to diagnose, that is rare. So I think that at the costovertebral joint, that it is subluxed or dislocated, and that's what caused the increased movement at the front. It has been secured at the front, but as a result of that, it's moving more at the back. The benefit of having it secured at the front, though, is that it's not pushing too well down into my hip when I'm, awake, which is, as long as I'm careful, which is good. What's not so good is that it's going to be an ongoing issue. There isn't really any well documented surgical procedure that can stabilize a rib that has come out at the back. There was one lady in the US who had a novel surgery using sutures to attach the rib to the spine, and I think she's about 10 months out. She's doing well. But I've discussed this with my surgeon, and my worry would be that because 11 is a floating rib, it's supposed to be attached at the back but not at the front. Mine has been attached at the front to reduce the movement. If we also attached it to the back, the rib wouldn't be able to expand with breathing, and it would restrict the lungs. Removal of the rib completely is not a good idea because it would likely cause scoliosis, because there would be one rib missing on this side, but its counterpart on the other side would still be there. So that would cause me over time to develop scoliosis. So I've got to get used to the idea that this rib 11 stuff is something that I will have long term. An idea that I had was I don't know if this will work, but it's worth a try. I'm just thinking about, common sense and physics here. If I strengthen the muscles around the ribs at the back, so the intercostal muscles, with isometric exercises, I'm thinking maybe strengthening the muscles and hardening the muscles around the rib might help it to stay in place and to reduce movement. The other thing that I'm thinking of possibly is prolotherapy, which some people have reported success with in terms of reducing pain. Prolotherapy is not available on the NHS. It is you have to pay privately for it, and obviously my income is not wonderful at the moment, so that's something that I would have to have at some point in the future. You do have to repeat it, and I was never really keen on having like sugar or salt or any strange things injected into my body, but it's got to the point where it's I just want this sorted, so I'm willing to try it. So there are options that will possibly make this easier to deal with long term. But yeah, in terms of the slipping ribs themselves, I think things are certainly better than they were and will continue to get better. I haven't had much in the way of abdominal pain. If I bend, I do, but I just bend at the legs instead of at the waist, and I'm just very, very careful. I've adapted things so that I can do some things. So I'll be going back to London probably in the next few months once I have enough money for the dynamic ultrasound, and getting there, it's actually cheaper to fly to Europe than it is to get a train from North Wales to London, which is crazy, but trains are very, very expensive here. Long distance trains, not local trains. Walking is still a bit of an issue. I can get up and down stairs okay. I can walk around the house okay, but walking in general, the longer I do it, the more pain I get. I'm still getting that spine pain, and I think that's stemming from rib 11. So hopefully in time, that will be something that we can work on with physio and maybe prolotherapy, and there may be other options, but at the moment it's just a case of trying to manage it. I'm still using my bed of nails, which is brilliant for pain relief, and cold and heat, although I've not used heat this week because it's been 40 degrees in the UK, which is very, very, very hot. Yeah, I'm just having a look at my blog to see if there's anything that I've missed. No, I don't think there is. So I'm hoping that I'm just going through a period of increased pain, and it will sort itself out in time. and that's it. I'm not sure when I'll be giving another update. There's good days and there's bad days at the moment, and it's a little bit all over the place. But overall, and I remind myself every day, overall, I am in much less pain in less places than I was 7 weeks ago. I still have to limit what I do, and I still have to be careful. But I'm grateful for that, because 7 weeks ago and in the early stages of this, I was in a huge amount of pain, and now it is, depending on what I do, it is manageable compared to that. So it's definitely good overall. Yeah, that's it really.